Welcome back to The Takeout. Thanks for hanging out with us. The White House has taken several actions this week to reshape administration policy regarding public health. Today, it rolled out new dietary guidelines recommending, among other things, against highly processed foods. And on Monday, it updated recommendations for childhood vaccines, advising for fewer shots. This move about vaccines facing pushback from some in the public health space. Our Nancy Cordes spoke with Health and Human Services Secretary Robert F. Kennedy Jr. and joins me now. Nancy, I remember, as you do, during the confirmation hearing, senators asked Robert F. Kennedy Jr. what his intentions were on vaccines. And if I remember the quote correctly, he said, "I'm not going to take them away from anyone."
Right.
How should we view that in the context of these new recommendations?
He said he would follow the science, and in some cases, senators' votes for him were contingent upon those promises. But now the CDC is actually doing a pretty notable rollback in the recommendations for the vaccine schedule for young children. For example, flu, rotavirus, hepatitis. They are now no longer saying all children should get those vaccines. They're saying some children, children who are at highest risk, should get them. Other kids can still get them, but only after consultation with their doctor. And so I asked the secretary today, why these changes? What is the scientific basis for it? Take a listen. What is the scientific basis for rolling back recommendations for vaccines that have been proven safe and effective for 50 years?
Again, the science is in the report. What we did is we looked at the scientific evidence, and we looked at the practices, the best practices of our peer nations, of the European nations. And what we centered on was the vaccines that are used by everybody, where everybody
Isn't every
agrees.
nation different, though? We're the most advanced nation in the world when it comes to science and medicine.
We also have the sickest population. The countries that have fewer vaccines actually have much healthier populations than us.
Is that because people use vaccines? Where's the evidence for that?
Not necessarily. But the vaccines are not sparing them those diseases. So, and all of those countries believe that if you put too many vaccines on the schedule, and vaccines that are unnecessary to stop common diseases that actually threaten children's health, that it is going to decrease uptake. It decreases the faith of the public in the vaccine schedule. But first of all, people should know we're not taking vaccines away from anybody. If you want to get the vaccine, you can get it. It's going to be fully covered by insurance, just like it was before.
But it is more difficult now for parents to get their children immunized for the flu, right? They can't just go to a pharmacy. They'll have to consult with their doctor first.
You have to, you need to do a shared decision-making with your physician, which is how it ought to be.
Fewer people will get the flu vaccine.
Well, that may be, and maybe that's a better thing.
Based on what evidence? There are 290 kids who died last year due to the flu. There's no evidence that any kids died or were harmed due to the flu vaccine. So isn't this inevitably going to lead to more children dying?
The Cochrane collaboration, which is kind of one of the ultimate arbiters of vaccine safety and clinical data, has done an extensive meta-review of the flu vaccine. And they found that there is no evidence that the flu vaccine prevents serious disease or that it prevents hospitalizations or death in children.
So, Nancy, you also asked the HHS secretary about the new nutrition guidelines and this recent clawback of healthcare funds to some blue states.
I did. And obviously, Robert F. Kennedy Jr. first rose to prominence, not only on the basis of a lot of his vaccine skepticism, which caught on with a certain portion of the electorate, but also because of his views on dietary guidelines and what he thinks Americans should eat more and what they shouldn't eat. So he came out with a new food pyramid today. You know, we remember the food pyramid from when we grew up, and it's kind of inverted now. Basically, he's saying processed foods, packaged foods, those have to go. Those are not healthy for you. Way at the bottom. Up at the top, higher than it was before, fats, full-fat milk, full-fat cheese, saturated fats and protein, red meat, that kind of thing, which is kind of controversial because the American Heart Association said today there is a link between eating saturated fat and high cholesterol, cardiovascular disease. In my interview with the health secretary, he disputed those findings. He said it's old science.
Nancy Cordes, always a pleasure. Thank you so very much.
You got it.